Today we are going to be discussing how to recognize, diagnose, and treat heat stroke. Common signs and symptoms include elevated core body temperature, CNS dysfunction, excessive fatigue, dizziness, headache, lightheadedness, confusion, dehydration, staggering, and collapse. The main difference between heat exhaustion and heat stroke is the temperature. Heat exhaustion is when the core body temperature is 104 degrees Fahrenheit and below, and heat stroke is when the core body temperature is 105 degrees and above. If heat illness is suspected, move patient to a cool, shaded area. Here you can elevate the patient's legs, provide fluids, monitor vitals, and apply cool towels to assist in cooling. If the patient does not show signs of improvement, take a rectal temperature to assess their condition and further treatment. To assess rectal temperature, roll the athlete on their side with their top leg bent. Drape the athlete to provide some privacy. Assemble the thermistor, turn it on. Clean and lubricate the thermistor. Insert the thermistor 4 inches past the anal sphincter. Take the external cord to the patient and leave the thermistor in place for the rest of your treatment. If the patient is aggressive or combative, you may need to get assistance in holding the patient down. If the patient has a core body temperature of 105 degrees or higher, call 911 and implement cold water immersion. If the core body temperature is below 105 but is close and they are presenting with signs of CNS dysfunction, err on the side of caution and continue with the treatment as you would for heat stroke. The best treatment for heat stroke is submerging the patient in a cold water immersion tub with water at a temperature of 35 to 55 degrees Fahrenheit and circulating. If a cold water immersion tub is not available, you can perform the taco method as shown in the video. Place a towel under the patient's arms to keep their head above water. Have coaches, staff, or if necessary, other athletes hold the sides of the tarp up while one person pours in ice water. The people holding the tarp should shake the tarp to keep the water circulating. The water should ideally be up to the patient's chest. Once the patient's body temperature reaches 102 or below, you can allow EMS to transport the athlete to the hospital. Thanks for watching.